Welcome to my YouTube channel. In this video, we are going to deal with hemorrhagic disorders. We know that the vessel wall, platelet or coagulation factor is essential to maintain a hemostasis. So, if there is any primary or secondary defect in the vessel wall, platelet or coagulation factor, then it leads to a abnormal bleeding disorder. For example, aortic dissection and aortic abdominal aneurysm leads to sudden massive hemorrhage. Here are some other causes for hemorrhagic disorders. For example, when there is a defect in von Willebrand factor, we know that the von Willebrand factor is present in the subendothelial matrix, which helps in the platelet aggregation. So, when there is a defect in the von Willebrand factor, it leads to bleeding disorder. Next, the aspirin consumption also leads to hemorrhagic disorders. We know that the aspirin is used to prevent the blood clot. It prevents the blood clot by making the blood thinner. So when the blood is made thinner, it leads to internal bleeding. Next is uremia, where there is increased amount of urea found in the blood because of renal failure. And the other condition which leads to hemorrhagic disorder is deficiency of clotting factor. This condition is usually inherited. Let's see about the conditions where hemorrhagic disorders are seen. First is defect in the primary hemostasis. We know that the primary hemostasis is the formation of platelet plug. That is, the platelet altogether gets aggregate because of the presence of von Willebrand factor in the subendothelial matrix. So, when the von Willebrand factor is deficient, then the primary hemostasis is affected. We should also know about the mucosal bleeding. That is, when the capillary in the mucosa is ruptured, it leads to mucosal bleeding. When the mucosal bleeding accompanies the defect of primary hemostasis, then it leads to epistasis, that is, bleeding in the nostrils. When there is a defect in primary hemostasis, it also involves very low platelet count, which is called thrombocytopenia. It leads to intracerebral hemorrhage. Next condition is defects of secondary hemostasis, where the coagulation factors are deficient. When there is bleeding found in the joints, it is called hemoarthrosis. The next is the generalized defects, which involve small vessels. When the blood is extravasated from the vessels, it leads to formation of hematoma. Next, let's see about the clinical significance of hemorrhage. The clinical significance of hemorrhage depends on the volume of the blood that comes out of the body and the rate at which it occurs and its location. Rapid loss of up to 20% of the blood volume leads to hypovolemic shock, particularly hemorrhagic shock. When the external bleeding occurs, it causes iron loss, which leads to iron deficiency anemia. Like, share and comment my video. Do not forget to subscribe my YouTube channel. Thank you for watching.